Hi, my name is Dr. Rain and I'm here to talk to you a little bit about gout. So the most common question is, what is gout? Well, actually gout is considered an arthritic process where the body produces too much uric acid, or it has difficulty in getting rid of uric acid, and then the uric acid increases in the blood, and the most common joint in the foot for it to deposit is in the big toe joint. Well, how does it present? Well, sometimes people come in with a red, hot, swollen big toe joint and they think it's a gout attack. What does it look like when we try to diagnose it? Well, when you come in, the doctors will do a thorough exam, including taking an x-ray. Because when we see a red, hot, swollen foot, we think, well, could be trauma, could be an infection, or could be gout. So we have digital x-ray here in the office. We'll take an x-ray and go over it with you. And there sometimes is radiographic evidence of gout, but in the absence of that, we might diagnose it just on clinical trial. So the gout actually is caused when the uric acid causes crystals and it gets deposited in this big toe joint here. So this is the skeleton version of it, but in a person's big toe, this whole area will be red, hot, and swollen and painful to touch. Sometimes people even describe that something as light as a bed sheet can't even touch it. So what does the treatment look like? Well, if we determine that you are in the middle of gout attack, we're going to do several things. Number one, we'll try to make you comfortable. Number two, we will go two different ways. We could take a sample of the fluid in the joint, send it off to the lab, and see if it indeed does have crystals. We could do a cortisone injection into the joint to kind of give you relief, or we will also give you a prescription for a very strong NSAID or non-steroidal anti-inflammatory to decrease the inflammation. The most important thing though is if you have big toe joint pain or any type of pain in your foot, to come and see us at Prairie Path Foot and Ankle Clinic. We'll do a thorough exam. We take x-rays right here on the premises and go over them with you and come up with a good treatment plan.